Well, good afternoon, everyone. It is now 1 o'clock, and today is December 9th, 2020. And as I stated previously, it's 1 o'clock. As a quorum of the subcommittee attenders video conference, I would like to call to order the meeting of the Central Health Eastern Crescent Subcommittee. I'd like to start today's subcommittee meeting with a few announcements and sort of administrative. First of all, I will be the acting chair of the subcommittee as Manager Jones is unavailable today. And additionally, Manager Valadez is out unexpectedly. And I would like to designate the following board members to be members of the subcommittee for today's meeting. I would like to designate Manager Zamora and Manager Oliver to be on the subcommittee with me today in today's meeting and act as temporary committee members. I hope you guys agree to that.
Happy to, Chair.
So with that said, our first item of business is public communications. We will receive public communication for both the Eastern Crescent Subcommittee and the Strategic Planning Subcommittee before we proceed to the subcommittee agenda. Members of the public who wish to make comments during the public communications portion of the meeting must have registered with Central Health via an online form or a telephone no later than 11:30 a.m. today. Yvonne, did anyone register to make comments?
Yes, sir. We have one member of the public signed up to speak.
Great. Yvonne Davila of Central Health Communications Department will briefly cover the guidelines for the public communications portion of the meeting, and will then introduce all commenters by name and invite them to speak in turn. Once you're recognized, please unmute your phone or your computer, state your name, and provide any comment. There's a 3-minute limit for comments per the board rule.
I want to let you know that this process may be ongoing, so this probably will not be the only training session, because once you see everything outlined, you may say, hey, I think we need some more help with setup, or we need some more help or more training.
Okay, not sure what that was, but it wasn't a part of our meeting. So Yvonne, do you want to continue for us?
My computer is freezing. I'm going to ask Anais to perhaps step in. My apologies.
No problem. Anais?
We can hear you, Yvonne.
I can hear you fine, yeah.
My Word document is not responding.
Gotcha.
I can read them, Yvonne. I'm sorry, I don't have them pulled up in front of me. Do you have them and I can access them?
Just give me 1 second.
Mike?
Good, and in consultation with council, if the technical difficulties don't allow us to have a public communication at the front end of the meeting, could we do it upon the conclusion of the meeting?
Yes.
Perfect.
Okay, so
Thank you, Mr. Giesman. I appreciate that idea. For anyone who's listening, we will move, because of technical difficulties, we will move the public comment to the end of the meeting. And so with that said, I would like to proceed now with the subcommittee agenda. Item number 1, discuss and provide direction on the processes for healthcare delivery planning, land acquisition, design and construction, and community engagement for interim and long-term facilities in Eastern Travis County, and provide direction on desired reporting formats for future meetings. I have Stephanie McDonald, Rachel Hardigree, Rachel Tarancho, and Yvonne Davila presenting.
Thank you, Dr. Bell. It is my privilege to be part of a fantastic team of Central Health professionals. We are working to advance the 3 projects in Eastern Travis County and are developing project plans for the Board of Managers consideration at your January 27th, 2021 meeting. Today we wanted to show you our work, where we're at, wanted to check in, make sure that we are addressing the components that you feel are important and information that you need to have in order to make a good decision in January. What we'll walk through are the components that we are working on, as well as some information around the design schedule that we've already shared with some of the community leaders in both Hornsby Bend and Del Valley, respectively, as well as some upcoming community engagement that's going to occur around this information. There is information that's still in development. This includes the project budgets and the startup operating costs that we are projecting for these sites, as well as what I might call site performance modeling, just kind of what we are seeing as a projection as these sites open and what kind of potential runway they may need from Central Health. With that, I'd like to turn it over to Rachel Hardigree, and she is going to walk through the components. There was a large amount of backup material in your packet. We are happy to address any part of it, but we'll not walk through it in detail today. If you have questions, we would love to respond to those questions, and if you want to send those questions to us in writing as well, we can certainly address that. Just want to also point out, this is a draft. We are still, we're actively working, and we can certainly pivot if we need to, and we really welcome your feedback at this point. So Rachel?
Okay, great. Thank you, Stephanie. Good afternoon, members. Yeah, so I'll present a few minutes here on the preliminary project plan, sort of the components or headings or table of contents, for lack of a better term, for the actual plans that we will be presenting to the board in January, to the full board. And then I will turn it over to Rachel and then to Yvonne to provide additional detail and information in their respective areas. I do echo Stephanie's sentiment. It's been fantastic working with this team. I think we've accomplished a lot. I'm really looking forward to hearing your feedback and making sure that we are addressing those specific areas that you all feel are relevant to address for these preliminary project plans. So at a high level, you'll see on your screen here, there's essentially 10 proposed component areas, which includes the introduction and overview and a background, essentially how we kind of came to where we are with these 3 priority project areas in Eastern Travis County. There's a significant section about the community engagement and communications that have gone on, both historically, present, and then for the future, our plans. Then there's the health needs analysis section, which really goes into a bit more detail into the data and findings that we have reviewed and discussed with the subcommittee over the past several months. And that folds over into the practice model and operational assumptions for each of those unique facilities in those specific areas. And that also incorporates those aspects that community care, the clinical operator, Jason presented previously. And then we've fold over into sort of the site and concept plan, development work, design construction, and then finally we get to the operational costs and financial analysis for each of the unique areas. So that's sort of a high-level overview. I'm going to turn it over to Rachel, but as Rachel's talking and as you guys look through this, if you think of anything in particular that might be missing or that really you really want to stress that we, the team, be sure to incorporate in these plans, please feel free to speak up or let us know following the meeting. But with that, I think I'm going to go ahead and turn it over to Rachel Tarancho for her sections regarding the plan. Rachel?
Great.
And
Thank you.
Brianna, could we maybe go back to one of the schedules? I think they're just a couple pages before this one. There's the circles as Rachel's talking. Thanks.
Great. Thank you. Yeah, so I'll just speak to some of the sections that we're going to in the project plans that will focus on the design and construction and the processes that we take in that piece as we develop the facilities. So this is our preliminary schedule. This is for the Del Valley site specifically, but I do want to call attention that it's very much similar to the Hornsby Bend site. These are really sort of in tandem, similar schedules. The sites themselves determine the schedule a little bit when it comes to the permitting and review process. So that's where you'll see some differentiation. So what we're at right now is in the programming of the spaces, and based on the service recommendations that I know was presented to the subcommittee at the last meeting and the work that Rachel Hardegree and team have been doing, we've taken those service recommendations and started to develop the programming of these spaces. And as we work through that programming, you guys are going to see, I know in the backup, there's different bits and pieces that we've added as far as the work that's been done up to this point, whether it be for Hornsby Bend or Del Valley. And that's really, just want to explain that's because it's different architectural firms that are working on each site, and it's different approaches for the firms. And that's really site driven. So that's why in the backup, you'll have a site concept for the Del Valley, and for Hornsby Bend, it's a programming document. So where we're at for both of these projects, again, is working on that programming, taking the services that were recommended and determining what spaces do we need to allocate in the facilities to accommodate those services. And for clarification, just to not get jargony, programming in this sense is the architectural programming. So what are those spaces, the rooms, and the facilities? And for the project plans, what we will be presenting in January will be the final summary of the programming that will go into the space. We will also have those concept designs, so the initial site concepts for both the Hornsby Bend site and Del Valley site. And post-January, that's where we will move into formal design. So that's when we get into the schematic design and really the details and level of the floor plans, and then design development through to the construction documents for these sites. We hope to get into permitting around April. Hopefully, there's some overlay for that, depending on the site plan versus the building permit. Those get submitted at different times, so that's why there's a little bit of complexity when you get to the schedule. So going into permitting and then through to the point where we are actually kicking off construction. So each schedule will show that sort of high-level overview. And then what we'll also be working on for my sections is determining the construction budgets. So our architecture firms for both sites are working on the build out for both projects, what that construction cost budget will be. So that's some additional information we will be adding into the project plans for January.
Thanks, Rachel. I think we can stop the screen share if that's okay. And Yvonne, are you able to kind of just address some of the upcoming community engagement work?
Hi everyone. Yes, thank you. So in your backup, you'll see our approach and our methods that we employ as we do community engagement for each of these projects. And I'm not gonna go into that because you have it in your backup, and also we'll be touching on that in the next meeting, the Strategic Planning Committee meeting. You'll see a list of different tactics for community engagement based on where we are on the project timeline, and also based on the community, what the community prefers as well. So there's a list of tactics in your backup. In December, we have two advisory committee meetings next week, actually, one in Del Valley, one for the Del Valley project and one for the Hornsby Bend project. So those are taking place next week. As a reminder, per direction from some of our board members, and also per executive leadership direction, we have created subcommittees. One in particular, though, for Hornsby Band, we have a subcommittee for Hornsby Band that is carrying the work forward. And so we are meeting with a subcommittee of Hornsby Band next week. And then, of course, making sure that all the committee members are updated via email. And then we are also continuing to keep our website updated. So they will be meeting the architects next week, and they will be providing the design concepts for each of these projects at the advisory committee meeting level next week.
Thanks, Yvonne. And with that, we're happy to answer any questions, get your feedback, to make sure we're all buckled up. I know that this is a very aggressive, but our architects are aware that it is our desire to break ground on both the Hornsby Bend and Del Valle sites this fiscal year. It may be September 30th, but we are working towards that goal.
Well, thank you very much. I appreciate that. Stephanie and team, Rachel, both Rachels, Rachel squared, I guess, and Yvonne, appreciate that. I'd just like to remind the members and actually any of the citizens that are present that there is a lot of detail that is included in the backup materials. So if you want, I mean, and it's fantastic. You guys did a great job in putting a lot of the detail out there. So I want to remind members and the public that that information is definitely out there. It will be updated, I'm sure, as time goes on. But you know, if you can't find your questions, I'm sure that staff will be able to answer your questions. But there's a lot of information and answers out there. So at this point in time, I'd like to open it up the floor for members if they have any questions. I think the staff is entertaining questions with regard to things that they may have missed in putting together this plan, and information that you would like to have reported on that's not included. So, or any other comments that you may or may not have with regard to this project. So open the floor for that. Okay.
Dr. Bell, I don't have any questions, but I just wanted to say this is very exciting, and it's exciting that we could be, fingers crossed, everything goes right, permitting goes well, breaking ground in 2021. So it's been a long time coming.
Here, here.
Thank you so much.
You. Here, here. Thank you, everyone.
Yeah, I'm always excited when I see those architectural renderings of things. That really makes me feel like I'm moving towards something that's a reality. So seeing a lot of that and seeing the maps and the areas that are actually going to be developed, it's very exciting. Thank you, members. Appreciate that. Anything else? Okay. Well, hearing none, thank you, staff, again, for the fantastic presentation and the great work. You've given us so much information, we don't have any questions, so that's always a good thing. Now, for agenda item number 2, receive and discuss an update on staffing and relocation of the Resource Center from Volma Overton Elementary School to Barbara Jordan Elementary School. And Stephanie McDonald and Melissa Cepeda are the individuals that will be presenting.
Thanks, Dr. Bell. So we're really excited to report that if you drive down Loyola Lane just past Johnny Morris Road, you will see a giant aqua and red portable that has been moved recently by AISD to the Jordan Elementary campus. We are hoping to relocate services and open up for in-person services starting in January after the holidays. We have kept Overton, and I want to just make sure that you all recognize that we, and I say we, a lot of this has been Melissa Cepeda, and Melissa has worked very tirelessly with community partners, and we think we have need for both of the spaces. The Jordan Elementary space will have dedicated enrollment and eligibility folks from Central Health there on site. Monday through Friday is the current plan. We will also have some other service providers there with in-person services as well as virtual services, and I'll let Melissa speak to that in a minute. I do want to let you know that AISD has been a real great partner, and we have not received back the agreement from them, but they have advanced this project, and we are hoping that they will paint the portable as well as make some other improvements to it, connect it to utilities, etc. But we are really feeling confident that sometime after the holidays, around mid-January, we can have a soft opening. And then we are also developing a comprehensive outreach strategy in addition to having a more official event later on in the spring. Melissa, do you want to just address some of the other services that will be at potentially both of these locations in January?
Sure. Do we want to share the table? Okay. So at Barbara Jordan, we will have the eligibility services, as Stephanie mentioned. We have Urban League that will be there also, that will be providing services under two of their pillars. One of which is the health and wellness, and the other is around housing. So if anybody needs housing repairs or ADA enhancements or anything that's identified as under that pillar, they're there to provide services to that community. Austin Public Health will be there with their neighborhood services division, which will provide bus passes or provide financial assistance for rent or utilities. And then also the WIC-mobile, they have a WIC-mobile that will be parked at the campus, similar to what Community Care does right now, and they will be providing their services. And then there's a larger number of virtual services, and some of these we've been having conversations that will eventually transition to in-person as their services are being delivered after COVID. One of those is Any Baby Can, all of their services, and some of their in-person services that we've been talking about once they transition are the mental health support groups or some parenting classes. Community Care, we will be, providing prescription assistance through their program for any of their patients. And then Austin Public Health has a chronic disease unit that provides virtual diabetes classes. And a lot of these services, once we get into January and we have a program manager dedicated to this site, part of this work will be to integrate these services into the clinical care system. So the care management team, if anybody is identified as being diabetic, for instance, for this, they will be referred into Austin Public Health for these classes. Central Texas Food Bank, providing some enrollment for SNAP and any of their other federal programs. They also have some healthy cooking classes that they're doing virtually. So we will offer that. And like I mentioned before, some of these will transition to in-person, but we will be promoting them at both services and assisting anybody in the community to get connected to those resources.
And Melissa, if I can just interject, to support that, we are actually working with Joint Tech to have a dedicated community computer in the site. And we know that that is tricky with COVID, but we do know that part of the challenge in the digital divide is access to both computers as well as the internet. So we will come back with a plan on how to be able to do that safely. And Dr. Bell, I think Manager Greenberg has a question.
Chair Greenberg, yes.
Yes, thank you. I do understand that's tricky with COVID, but I appreciate your efforts. I think that's important. Also, hotspots are important. Broadband, high-speed internet. Thank you.
Sorry, Melissa, I'll let you continue.
It's okay. So just a few more. Texas Rio Grande Legal Aid providing services. And some of these services have also provided services at the Southeast Health and Wellness Center. So they're very familiar with the population we serve. And, some of those programs have already been developed. Austin Diaper Bank, we have a partnership with them to provide period supplies and diapers through the program. And that program is being developed. It'll probably be a monthly distribution to the community. And then going over to Overton School, this site is more designed for community space. There's no offices in it, whereas Barbara Jordan does have the office space. So Black Mamas ATX will be providing some doula services and, anything for pre and postpartum help, some psychotherapy help, case management. There's a lot of different things that they're going to be providing at that site. Other than that, we're looking for other community partners to provide space there. It's also available for any neighborhood activities or, you know, special things that they have going on, neighborhood meetings that they may need access to a community space for. We'll have that available. And then also in your package, you'll just notice some existing services out in the community that are in there. And then,
Thanks, Melissa.
yep, and I would just say, like Stephanie mentioned, we don't have a hard go live date. We're projecting mid-December, and a lot of this is dependent on some of the site work that's still going on at the school, such as IT, connecting utilities, but we're hopeful that that will be done by the end of this calendar year, and our community partners are ready to begin delivering those services.
Thanks. We're happy to answer any questions. And, you know, this is all very fluid, so we will come back to you with a schedule and more outreach activities detailed.
That's great, Stephanie. Thank you. Thank you, Melissa. Before I open it up to the other members, I would like to ask a question with regard to, I know that we're keeping both sites. I think one of the reasons that we moved to Barbara Jordan was that it's a much more visible site and easier to get to, so to speak. But in keeping both sites, are we doing any work to make it easier to get to the other site if necessary? Stephanie?
That's actually a really good question. And part of the reason why I think that, you know, Melissa and Black Mamas ATX are kind of concentrating at the Overton site is because the people who are enrolled in that program and who the expecting mothers will be given very explicit directions to that site, and it will not be attracting just people coming in from the community. So I think that is actually, and then we may have it available, but again, to your point, we'll have to give very explicit directions to find it. There is signage out there that exists. A lot of the signage right now has been redirecting traffic to the Turner Roberts Rec Center for community care's COVID testing that occurs next door. So we will have to think about that, but this is a way for us to facilitate some of the sister doula programs that Black Mamas ATX hopes to do in the community, and I think for a very specific population.
Excellent, excellent. Thank you very much. Any other questions from the members? Questions or comments? Okay.
Hi, I'm Connie Gonzalez, and I'm with Austin Public Health. Can you hear me?
Yes, I can hear you, Connie.
Okay, I just had a couple of questions. This is exciting news because we were always trying to promote that site.
Connie, can I interrupt you a bit? This meeting, we can only take public comment during our public comment period. The only
I'm sorry.
Yeah, so we are unable to accept your comment at this point in time, but we welcome you to provide any comment by calling in and putting your name on the list, and we will call you up either at the beginning of the meeting. We had some technical difficulties this time, so we're going to go into it at the end of the meeting. We appreciate your attendance for sure, and hope that you will provide some comment later.
Okay.
Thank you. Anything else from members? Okay. Hearing none, I would like to move back to our comment period. We were having some technical difficulties. Members of the public who wish to make comments during the public communications portion of this meeting must have registered with Central Health via the online form or by telephone no later than 11:30 a.m. today. Yvonne, can you let us know if anybody's registered?
Certainly. We have one member of the public signed up to speak, and at this time I can go ahead and read our guidelines for public communication.
Go ahead, Yvonne. Thank you very much.
Thank you, Chair. To be recognized to speak, you must request a speaking slot using our public communication online registration form or by leaving a voicemail 90 minutes prior to the start of the meeting. Individuals are asked their preferred language as they register to speak, and both the online form and voicemail greeting are in English and in Spanish. Please introduce yourself by name before beginning your comments. And if your comments will focus on a specific item or issue on the agenda, indicate the full item number. Each speaker will be limited to 3 minutes. Staff will be timing each speaker and will announce when a speaker has reached their time limit. To ensure the efficiency of the meeting, once we have let speakers know they've reached their limit, we will allow 30 more seconds to wrap up their comments before they are muted. Once again, speakers will be muted at 3.5 minutes to ensure the efficiency of the meeting. Due to the restrictions of the Open Meetings Act, the board may be restricted in discussing any items that are not listed on the agenda for this meeting. The board may choose to set aside any new issues or discussion at a future meeting. With this, I'm going to call on our speaker, Ms. Mia Greer. If you can please unmute your computer. You have 3 minutes.
Mia Greer, I'm with Community Coalition for Health. I am also a community member. And first thing I want to say is I applaud Central Health on their community engagement that's been happening over the last, I say 6, 7, 8 months. You can tell in the community that they are, it's being effective. You can tell that people are being reached. People are starting to know the name of Central Health and what they stand for when it comes to the COVID-19 situation right now. And I applaud and congratulate you guys on that. I know you don't get that very much, especially from me. So I just want to thank you guys so much. I wanted the board to know that that we are really, really excited that the reputation of Central Health is starting to take a turn when it comes to communicating with the community. So thank you very much. And on that being said, I want to make sure that with these buildings and properties going up, that the same type of communication is given to the communities regarding the steps that that everyone has put into making this process run smoothly. I like the steps; they're great. It's a lot. You can see there's a lot of work into it, but my fear again is the African American and Latino population not knowing the process or not knowing where they are or what they can do. I don't know if it's a continuation of what's been happening to reach the community, where it's groups of like Latino Healthcare and Community Coalition for Health. We've really held hands in making sure that the communities know what's going on when it's due to COVID. But I also think we need to do the same type of thing when it comes to how things are going with the projects that's happening in their neighborhoods. I think they're very succinct, and I think that things are moving in a direction that's forward. But I don't think a lot of the community, especially the African American community, is aware of the things that is coming down the pipeline in a manner that they feel excited. I feel excited. I know that there's a lot of people who are excited, but I don't know if the message is getting to them on a week by week, month by month situation. I know that there's a subcommittee, but again, with COVID going on, they're listening more with the things that you have to say. And so maybe we can move forward by using the same methods that you use for COVID as what you're using for what you would use for the information for the projects.
Ms. Greer, 3 minutes is up. You have 30 seconds to wrap up your comments.
So that's what I'm saying. So we make sure that we reach the community, we reach the African American community. We make sure that they are aware, the Latino community, they are aware, and that what we've been doing is working, so that we just change the subject and we use the same information, the same ways to get the information out, because it seems to be working. Thank you very much.
Thank you, Ms. Greer. Dr. Bell?
Thank you, Ms. Greer. I really appreciate that. I can't speak for all the board members, but you made my week by giving us some positive feedback on some of the things that we are doing in the Eastern Crescent. And I thank you for that. I know that we still have areas that we need to improve, and we hear you. Now, I am told that legally I can make an exception with regard to Mrs. Connie Gonzalez. And I would like to ask Mrs. Gonzalez if she would like to speak at this point in time. We can allow her 3 minutes to speak.
Thank you, Mr. Bell. And sorry, I'm not used to the new process for this meeting, so I missed that part. But thank you. I simply wanted to commend y'all on the decision to move the clinic from or move some of the services from Turner Roberts. We tried our best to help get the word out about it. It's just when we've conducted events there as well, it's hard to get the people there for some reason. Maybe it's not as visual. So at Barbara Jordan, I really anticipate that you're going to have a better outcome, and then we will help in any way that we can at Austin Public Health to get the word out about the new site, to make sure that the public is aware of it. I did miss one thing in the presentation by Rachel about the services at Overton Elementary. She said there's no office space, but are you still going to be using the building that y'all were using at the beginning? Yeah, okay. So it's in the back of the school, right? Okay.
It's in a portable, it's in half the portable. We share it with the Boys and Girls Club. And it has had kind of an office setup in it previously, but no permanent walls that divide offices, unlike the new portable at Jordan Elementary.
Oh, okay. And what was the name of the group that is going to be providing the services, if you don't mind? I missed that part.
Specific to that site, we believe it will be Black Mamas ATX. And all of this is subject to some more formal partnership agreements being executed between both parties.
Okay, well, thank you so much. That was just what I had to comment. And thank y'all so much, all of y'all, for your dedication to the community. Thank you.
Thank you, Ms. Gonzalez. We really appreciate it. Thank you for your comments and questions and for attending the meeting. Members, before I go to the next agenda item, do we have any members that would like to make a comment or ask a question? Okay. Hearing none, my next agenda item, which is the last one, is to confirm the next Eastern Crescent Subcommittee meeting date and time and location. Managers, our next Eastern Crescent Subcommittee meeting is tentatively scheduled for Wednesday, January the 13th, 2021 at 1 p.m. at the Central Health Administrative Offices, 1111 East Cesar Chavez Street, Austin, Texas, 78702, and or remotely by video conference, depending on the status of the governor's disaster declaration and stay-at-home orders. At this time, I'm ready to accept a motion for adjournment.
I move to adjourn.
I have a motion from Oliver. I have a second from Chair Greenberg. All in favor?
Aye.
Any opposed? Any abstaining? We are adjourned. And members, I'd like to tell you that our legal counsel has structured it now so that we can go directly into our strategic planning meeting. And so there's no need to wait unless the members need a break of some sort. But I think everybody might be okay, and I don't expect our strategic planning meeting to go very long. So at this point in time, I will switch over to my strategic planning agenda and say good afternoon. It is December the 9th, and it is 1:39 p.m. As a quorum of the committee is in attendance for our video conference, I would like to call to order the meeting of the Central Health Strategic Planning Committee. As we started the Eastern Crescent Subcommittee, I need to start today's committee with an announcement. Because Manager Valadez and Manager Jones and Manager Musaiti are unable to attend our meeting, I'm requesting of Chair Greenberg, who is empowered by our bylaws, to name members of the committee, including herself, so that they can act in the place of our colleagues for today's meeting. Chair Greenberg?
Yes, thank you. Pursuant to powers vested in the Central Health Board Chair, pursuant to our bylaws, section 7.5, I hereby name myself as a temporary member for the Strategic Planning Committee, and I also name Managers Zamora and Oliver to serve on the committee for the December 9th, 2020 meeting.
Thank you very much, Manager Greenberg, Chair Greenberg.
Thank you.
That makes it easy to manage our quorum. And so I'd like to get on to agenda item number 1, receive and discuss an update on communications and community engagement activities and initiatives, including external affair strategies. I've got Ted Burton, Yvonne Davila, Isla Guerra, Anastasia Sims, Chelsea Baez, and they will be our presenters today. Ted?
Okay. Thank you, Dr. Bell. I am Ted Burton, Vice President of Communications, and we can go to the next slide. As we wind down 2020 and look ahead to the new year, we want to take a few minutes to explain how the business units that support our external affairs efforts work together in concert to help Central Health achieve its mission by caring for those needed most. Central Health improves the health of our community. There are 4 business units under the external affairs umbrella, all of which are supporting our FY21 strategic objectives and priorities. And those business units are communications, community engagement, outreach, and government affairs. 3 of these business units fall under communications, and government affairs is led by our Deputy Administrator, Perla Cavazos, and supported by Celso Baez. And all of my team members will join me today in presenting about our efforts. We're first going to walk you through the goal of each business unit and some of the tactics that we employ to meet our strategic objectives. Then we're going to show you a few examples of how our business units work together in action to support all of our external affairs efforts. So I'm going to start on the next slide by introducing Isela Guerra, and she is our outreach supervisor. Isela?
Good afternoon, all. As Ted said, I'm the community outreach supervisor, and I lead the team made up of Edwin Evans and also 2 part-time community health workers that are helping us reach out to MAP members. The community outreach business unit's goal is to connect Travis County residents with low income to healthcare services and to healthcare coverage. So some of the tactics that we employ include canvassing, peer-to-peer education, where we are speaking directly to residents or MAP members, speaking engagements and presentations to community groups, homeowners associations, anyone who will have us really, Facebook group outreach, where we promote some of the initiatives and events that we either are hosting or participating in, keeping our members updated with weekly emails, and also attending community events throughout much of the community that we're trying to reach.
Yvonne?
Thank you. I'll talk a little bit about community engagement. So to ensure that our strategic priorities and budget align with the healthcare needs of our community, Central Health staff rely heavily on demographic and clinical data. We also annually prioritize involving residents in a robust community engagement process. So through systematic community engagement methods, our goal in community engagement is to involve residents in the work of the organization, creating ambassadors to amplify our mission. We engage with residents to gather their feedback through community conversations, and you'll see that under tactics, community advisory committees, online and paper surveys, as well as one-on-one interviews, either in person or over the phone. We also rely heavily on communication and outreach tactics to ensure that we're involving consumers in the public participation process. Next, I'll turn it over to my colleague, Anastasia.
I want to go off script for 1 second and brag on our community engagement team. During this year of COVID, and I'll mention this later as well, we actually have increased our community engagement participation rates by 60%. And during a pandemic, I think that's really amazing. And all the credit goes to Yvonne and his leadership and our team.
Thank you, Ted.
Anastasia, our next superstar.
So I'm Anastasia with the communications team, and our goal is to create brand awareness about the Central Health Enterprise, as well as our health coverage programs, MAP and MAP Basic, by reaching various audiences through digital, traditional, and social media. Some of the tools that we use are media relations with our local media stations, social media, video technology, our new bilingual website, e-newsletters, paid advertising, crisis communications, and along with our work with our public relations vendor, Han Public, who through a competitive RFP was chosen as our PR consultant.
I'm going off script one more time. I also want to thank Mike McKinnon, who's not part of the presentation, but you had the opportunities to see the results of his amazing work with our new website. I hope that you've taken a few minutes perhaps to explore the website and look at all the amazing features, and just a reminder that it was consumer tested, patient tested. So it's really part of our diversity and inclusion efforts. And so I just wanted to say that. And also Mike kind of floored me when he reminded me that this past year we've produced, thank you Anastasia, about 90 videos, and I don't even know how many social media posts. So this is also part of one of the hardest working teams in the world here. So thank you, Anastasia, for you and Mike for that work.
Thanks, Ted. Now I'll hand it over to Celso.
Thank you, Anastasia. Good afternoon, Chair Greenberg, Board of Managers, President Giesling. I'm Celso Baez, Government Relations Manager. Much to the tactics and philosophy that Ted and his team articulated for the Enterprise's engagement and communications shop, our government relations work similarly centers around a foundational tenet, which is engendering trust and building and maintaining and strengthening relationships. We nurture our relationships with elected officials, key stakeholders, and our intergovernmental partners and peers by way of regular, transparent communication, and serving as a resource when our expertise is requested as an enterprise. A chief example being our work during session, our annual budget process, and other issues as they arise. We accomplish this in a number of ways, but not limited to frequent briefings, presentations, updates, policy analysis, and what we're newly calling spotlight reports. And these spotlight reports are intended to offer both a top line and deep dive into a variety of the enterprise's robust efforts towards better serving our community. We also strive to strategically position you all as board members and executive staff internally with the best intel possible to assist and inform in your decision-making with regard to policy or regulatory matters that could potentially impact the enterprise. Thank you for the opportunity to expand upon our government relations work.
Thank you, Celso. We can go to the next slide. And Gisela's gonna provide an example of how all the business units are working together to support one specific strategic objective for next year. Gisela.
Yes, thank you, Ted. Here we have an example of how our business units work together to support the strategic objective of service expansion in the Eastern Crescent. Our communications team, as you've heard, has a great new website, and this website will feature sections by priority area that will include updates on the service expansion projects, including timelines, background, and funding. We also have planned geofenced paid advertising, social media, and earned media targeting people who live near these planned facilities and expansion. And we test our messages with stakeholders and consumers to make sure that we are striking the right tone so that it's a message that they'll pick up on. Our engagement team in FY 2021 has expanded the advisory committees to include subcommittees with specific focus areas. And they are conducting one-on-one meetings with advocates and key stakeholders. So they're able to get immediate feedback from people who will be affected or who are stakeholders in that area. And we're also planning virtual community conversations in light of the pandemic and exploring how to integrate virtual meetings and in-person meetings going forward, because we have found, kind of a successful formula there with engagement being done virtually, and engaging homeowner associations and other partners in these areas. Our outreach, we continue to conduct neighborhood canvassing, literally dropping off information at people's doorsteps. We will continue to reach out to businesses, churches, apartment complexes in these areas of service expansion, and reimagining our outreach events. We have pivoted to make them drive-through events, and we'll continue to call one-on-one our at-risk or hard-to-reach MAP members who may not be digitally connected and receiving our messages via email or social media. And then our government affairs business units, they maintain our elected officials up to date. Their new Spotlight report really is able to provide them a lot of detailed information so that they can be aware, and also help us amplify the message of our service expansion, that's in their districts. So together, we all work to promote these new service expansion lines.
And Isela has been a key piece of our pandemic response. She's been managing our community health workers who've been making those one-on-one phone calls to high-risk, vulnerable, and often hard-to-reach MAP members. So we really appreciate Isela's great work. And the next slide is Yvonne.
Not to mention, she's also been overseeing a couple of vendors who are helping us with outreach, expanding capacity in terms of outreach. Just wanted to also mention that. So here's another example of how our external affairs business units support fiscal year 2021 budget resolution strategic objectives. This particular example revolves around diversity and inclusion. So to improve our effectiveness in the way that we address systemic health inequities at Central Health, we are committed to creating a culture of diversity and inclusion across the enterprise, keeping our collective purpose in mind, which is to improve health outcomes for those who are most impacted by health disparities. In addition to communicating our work around diversity, equity, and inclusion, our staff works diligently at centering equity in our work. You'll see that in the table, the table that's on the far right-hand side, how our tactics are used, or how we use our tactics to highlight equity and inclusion work. And we also embed diversity, equity, and inclusion work in our work. So for example, under communications, as we've mentioned, we have a new patient-centered, fully bilingual website. We also work arduously at making sure that our materials are culturally competent and that our paid media is targeting people of color. In terms of our engagement efforts, we're ensuring that minorities are involved in our work. We've embedded health equity training in our Community Health Champions program. They can help plug into our work to address health inequities. So for example, the class of 2019, last year, they built a business case to bring health equity training to staff across the enterprise. And this business case was approved, and that's how our health champions are helping also drive health equity across the enterprise. Community outreach, specifically targeting people who are most impacted by health disparities by partnering with faith-based centers, schools, nonprofits, apartment complexes, etc. And as mentioned before, government affairs, CELSO in Perla are also conducting elected official briefings and email updates. And as CELSO indicated earlier, a new tool in our toolbox is Spotlight reports. And we've just now finished producing one around diversity and inclusion that I'm sure you will be seeing soon. Anything else before we go to the next slide, Ted?
Thank you, Yvonne. No, that's great. And speaking of diversity and inclusion, one of our other superstars, we have a team of superstars on the Dream Team, is Jana Allen, and she's actually left our community engagement efforts and is moving into a new role with our Human Resources Department as Diversity and Inclusion Manager. And I'm sure Susan will update you that soon at the appropriate time. Edwin Emmons, who is one of our generalist who can create amazing content, video production, but he's also an outreach expert. And today's his birthday, so hopefully he's not watching or he's doing something special. And of course, Mike McKinnon, who you presented last week, and Anais Cruz, she manages our Health Champions program, and she's also one of these rock stars that can do it all: create content, do outreach, engagement, and most importantly, keep our team really organized. She's really great at cracking the whip. So I think she's watching today as well. On this next slide is, we've presented this to you before. We call it our long view. And I won't read this to you, but it is in your packet. But it just shows you over the last 5-6 years, the last really 5 years, and looking ahead to next year, from a communication point of view, some of the milestones. So in 2016, when I first started, we did an awareness survey and found awareness of Central Health at around 18%, but great support for our mission. The Board of Managers at the time, Sherry of course knows this well, invested in a public education initiative, which began in late 2017. Following that public education, a really intensive month-long initiative with television. We doubled awareness of Central Health. So it was this classic case of proof that advertising works. Also in 2017, we, under Yvonne's leadership, did staff training for the systematic development of informed consent, a community engagement model that he's going to talk about in a few minutes. As you know, in January, there was the Germain Solutions Report, January 2018, that showed a confusion among residents in Travis County, not understanding the enterprise, its value, and how it's connected. In March of 2018, under Mike Gieslin's leadership, community engagement and outreach moved under the communications umbrella into the communications team and began reporting directly to the CEO. 2019 was a busy year. We launched phase 2 of our public education initiative, and something that you've been briefed on several times, our unified naming and branding system initiative, and continued to further integrate our enterprise-wide communications, outreach, and engagement. We also began our community health worker pilot under Izella's leadership, implemented our logic model, which Yvonne's also going to touch on in just a few minutes, and conducted yet another survey, awareness and education survey. And while awareness wasn't as high as it was previously, it remains high among Latinos and African Americans. 2020 has been a really interesting year, which is probably the understatement of the year. We were continuing our enterprise co-branding initiative. We hit pause when the pandemic hit because we really pivoted and began to focus almost exclusively on pandemic response. And so we've touched on some of those efforts. It includes the faith-based business outreach in high positivity zip codes, MAP member outreach, those phone calls to high-risk MAP members who may have been falling through the cracks and not getting critical information about testing and isolation. We've had a very significant paid advertising budget during the pandemic, and thanks to this board support, I've invested about $400,000 in paid advertising directed specifically at communities of color at high risk for COVID-19. Earned in social media. If you haven't seen some of the work of Anastasia and Mike, then you definitely are not tuned into any electronic devices. And then of course, crisis communications as that's come up. I mentioned earlier, really proud of this team, that there's been a 57% increase in community participation, even as we pivoted and went almost exclusively virtual. Again, that's for the fiscal year. And Anais and Yvonne helped turn our Health Champions program into a virtual Health Champions program. And I think we'll see the surveys at the end, but as that this year wraps up, I think the surveys will be as strong as ever in terms of how much people have gotten out of the program. And then government affairs like this, and the Board of Managers, thanks to your work and our amazing finance team, unanimous approval of the Central Health budget just this past September. Looking ahead, and I'm going to go quickly through this, we've launched a new website. This is part of our FY21 priorities. We've hired an advertising agency of record to continue our good work there. We are expanding our outreach capacity. We are going to be hiring 2 outreach specialists and a graphic designer, so we can bring a lot of that work in-house. Our community conversations are going virtual. There's already an editorial calendar that we will, I believe it's part of this packet, which talks about the schedule for the community conversations. The Spotlight report has been in the spotlight during this presentation. Can't wait for Celso and Perla to share that with you as well. Next slide. And I've mentioned the considerations that we've faced with the COVID-19 pandemic, and I think the whole organization has responded in a really amazing and admirable way. Just some quick examples of how the COVID-19 pandemic required us to pivot on a dime. Online map applications, you can now apply online 24/7, and map is front and center on our new website. I mentioned the virtual advisory committee meetings, community conversations, and health champions program. Our one-on-one calls to MAP members, as Ella could tell you, I think there's been more than 3,000, maybe pushing 4,000 calls that we've made, completed. Drive-through community events. Elizabeth Manetto is not on the call, but she can also report out that we have, under her leadership, distributed more than 100,000 face masks and 50,000 hand sanitizers, as almost all of our community events have become drive-through events. And I mentioned the paid media a minute ago, but more than $400,000 in paid media, specifically targeting communities of color and those at high risk for COVID-19. And we can go to the next slide. So now our team will just quickly talk about some of the best practice models that guide our work. We don't just make this up as we go. We have a strategy and we have models that we're following. So I'll let Anastasia take over.
Sure. So we've adopted the SMART objective, which is an industry accepted best practice. It's the framework for our communications, community engagement, and outreach efforts. S is for specific, M is for measurable, A is achievable or attainable, R is relevant, and T is timely. Next, I believe it's Yvonne.
Isela. No, same slide. Sorry about that, Brianna. Thank you.
Sorry. So our outreach program is based on the theory of change, which is a theory that aligns our activities with our desired outcomes. So based on that, we have a logic model made up of the 6 components that you see there that really helps us implement and use our resources on specific activities that will lead to connecting Travis County residents with low income to healthcare coverage and services in a way that can be tracked and evaluated, so that, you know, if we can ensure we're getting the desired outcome, and if we're not, you know, we can make tweaks to get us to where we want to be.
Thank you, Zola. Yvonne?
All right, and in terms of engagement, as a tax-funded public entity, we use a systematic approach to community engagement and public participation. This approach employs methods recommended by the Systematic Development of Informed Consent public engagement process from the Institute for Participatory Management and Planning. And this method is used widely by other local public entities like the City of Austin, Capital Metro, Austin Independent School District, and many, many more across the United States. It is used to build informed consent or buy-in from key stakeholders or potentially affected interests by strengthening or maintaining the legitimacy and credibility of our problem-solving processes.
Thank you, Yvonne. Next slide, and we're actually wrapping up. So as I close, we just wanted to emphasize that as all of us are navigating this new normal, we want you, our board of managers, and of course the community to be assured that our team has a plan in place to support the organization's strategic objectives and priorities, and consistently engage all of our stakeholders, from patients to partners to elected officials. We have learned many lessons from the pandemic. It forced us as an organization, but specifically our external affairs efforts, to be nimble and flexible. But I think it also reinforced that we have a system in place with the right people and processes that allows us to quickly pivot and get vital life-saving information out to our community when they need it most. And so I just couldn't be more honored and fortunate to work with such amazing passion. I keep saying amazing, but it's a word that just falls out. But such passionate, professional, and dedicated staff, all supporting our external affairs and external relations efforts. And with that, I'll take a breath, and we're happy to answer any questions.
Thank you very much, Ted. I mean, first of all, I don't have enough words to thank you for all the work that you and your team have done. This is really amazing, absolutely amazing, the work that you do. Anastasia, Celso, Isela, Yvonne, I mean, you guys are really, really out there and have moved the needle with regard to our visibility as a health district to many of the areas of Travis County. And I can't really thank you enough. I have a couple of questions, but I'm going to recognize Chair Greenberg first and any other board members, and then I'll ask mine. Chair Greenberg?
Yes, I don't want to be repetitive, but thank you, thank you, thank you. Thank you to all the staff I see here virtually, and all those who are not here with us virtually today, but have worked so hard on this effort. It just about brings me to tears. And I cannot tell you how many times I hear from community members and stakeholders about the communication that they are getting through different channels, modalities from Central Health, and how they look to Central Health, even some people with other organizations or other governmental entities, that they now look to Central Health. So thank you so much. And Ted, yes, I cannot help but think back to when I first got on this board, and then you first got here, and how should I put this? The push that I made for us to have a more robust education and outreach staff and efforts and planning here at Central Health. And I just want to say to all of you, you have far exceeded my expectations. Thank you.
Thank you, Sherry. Thank you, Dr. Bell.
Any other comments or questions? Manager Alva?
I'll reiterate what Sherry said. Oh my gosh. When I think about when I first got on the board to where we are now, it almost feels like two different organizations, and y'all have really, really matured this process of community outreach and really engaging the greater Austin area. And so thank you. I know I don't want to sound too redundant, but thank you, thank you, thank you. I'm so impressed with the team. I really am so incredibly impressed. Thank y'all.
Thank you.
Excellent. Dr. Zamora, did you have anything?
I want to say the same thing, Chair. You guys are rock stars. Y'all are incredible. Thank you for your hard work.
Thank you, sir. I have a question that I would like to propose really to the team. It's a conversation that I've had with another board member offline, and that is, many times when we work with populations that are not necessarily used to using insurance, and thus being able to access those medical services that are not needed urgently, but more on a preventive means. Are there activities within your group that tends to touch those populations where, we look at it from a data standpoint as non-utilization? And, but in essence, what non-utilization means to me is that somebody has the ability to have a annual physical exam, or to have their blood pressure taken, or to be followed up for their blood pressure or their glucose on a regular basis to keep it in tight control. And so sometimes I think people don't have the ability to be able to understand our healthcare system enough to realize how to engage it when they should. And so the question, trying to make it as simple as possible, is, do we have activities that target individuals like that to ensure that they understand how to access the system and be able to be provided with services that, they not only deserve but are eligible for?
So Dr. Bell, I can begin. I know that Yvonne and Isela will be chomping at the bit to weigh in as well, but when I mentioned expanding outreach capacity, this is exactly the kind of work that we will be able to continue, that we began with our community health worker pilot, where we, developing programming to help people understand the healthcare system, our Way to Wellness program, how to improve things that happen outside of a clinical setting. So we are bringing on 2 community outreach specialists that will help us continue those efforts on a more consistent and full-time basis. And I don't know if Isela or Yvonne want to weigh in. Yvonne?
If I may just add to that, thank you, Ted. So our medical management team focuses on people with very complex conditions and complex cases. So what we're doing with our community outreach specialists we're in the process of hiring is create more capacity around what our medical management team does, but focusing on a separate subset of our patient population, with a goal, following the logic model. The goal will be to ensure retention for members. And in that retention, and Isela will have even more detail on this, in that retention, it'll be a lot more education for our MAP members to ensure that they understand their benefits fully.
Isela, do you have anything to add? Where's Isela?
Hi. No, I just would add that in addition to working with our medical management team for those complex care patients, part of the new roles, duties will also be to reach out to people who are newly enrolled in the medical access program and thoroughly explain the benefits, where to access services and what's available to them. So yes, that definitely more of that coming soon.
I think someday we should write a case study on the work that our health workers have done during the pandemic to reach hard to reach populations, people who fall through the digital divide, because it really has been amazing. And the responses, and Isela can share those if you would like to hear them, but just anecdotally, the things that we've heard from people who've received a phone call and just have expressed that they didn't have information, didn't know where to turn for information. They were really kind of just out there in the dark. So it's almost going back to the most basic old-fashioned type of outreach, where you have a conversation with somebody. You don't expect them to go to a website. You don't expect them to be on social media, but it's an old-fashioned one-on-one conversation about things, about information that they just may not be able to get anywhere else. And we're going to do more of that.
Thank you, Ted. That is excellent. Really appreciate the information. Mr. Giesland?
Just wanted to recognize Monica. She had her, just draw your attention to Monica.
I'm
She had her
sorry.
hand up.
Oh, no, thanks, Dr. Bell, and thanks Ted, Yvonne, Isela, I think it's also important to just highlight that the work that Isela and Ted and Yvonne were just discussing is also being conducted as part of this overall alignment of community health workers, community outreach specialists, and care managers across the entire enterprise. And Yvonne and Sarah and Isela and folks at Community Care have all really been working, and Veronica Butron Camacho have all been working really carefully to make sure, and Dr. Shalsha, to make sure that these efforts are clinically informed, that they're aligned, that we're not duplicating contacts with people, but that we're all kind of rowing in the same direction, not duplicating effort, and working together, toward this higher goal of retention and people understanding how to best use the system. But I do know that sometimes there are questions, particularly that the board has, about, are we duplicating effort? Are we really aligned? And this work is part of this larger effort. And I think it's really exciting to see how this team is interacting across not just different departments in the communications area, but in, kind of the clinical world as well. So thanks, y'all.
Thank you, Monica. I appreciate that. Chair Greenberg?
Just a quick comment and question. Thank you. Alignment across our enterprise has been a big concern of mine in all of these areas, and I appreciate all that you are doing. And Ted, as you know, alignment across communications efforts across everyone in our enterprise has been a concern of mine, whether it's branding or public information. Can you just address in a few minutes what's going on as far as alignment across our enterprise with Central Health, Community Care, Sendero, with our comms teams?
Sure. So we meet weekly with the enterprise communications, community relations, and community engagement teams. So the leads from Community Care, Sendero, and of course our team at Central Health to talk about short-term, long-term goals, needs. It's been especially critical during the pandemic. So I think the alignment has. I think the pandemic has only brought us closer together because we've had no choice, to be honest. But we still have work to do. And I think, as you mentioned, the unified naming branding system, I think it's still a challenge. When we're out in the community, we still hear people that are confused by who is Central Health and what does Central Health do and who is Community Care and how are we connected. I see it firsthand just with the media calls that I take, which, they're usually at least one a day because they're not sure who to call for what. So I guess my short answer would be that we've come a long way and we continue to move forward and we meet regularly and we're integrated, but certainly there's more work to be done. And we plan to continue that in FY21.
Thank you so much.
If I could follow up to that, please. But I think Yvonne first mentioned this and Monica expounded on it as well, but it's truly a shift in philosophical approach that I think fuels our alignment efforts, in that we don't look at healthcare as just what happens in a clinical room, for instance. There are a lot of things that are part of that healthcare experience, including the communications and outreach, the public awareness, the education piece of it, eligibility services. It's all, from the first step that you make in, all throughout your life that you're where we provide your care. It's all part of that healthcare experience. And again, it's that philosophical shift that I think is driving this alignment, and something that, quite frankly, we need to be very mindful of and tend to, not every so often, but on a daily basis.
Thank you. I concur. I think this needs to be part of our core strategy. Thank you.
Thank you all. Great discussion. I did want to add on to a little bit of what I heard Yvonne say, and the fact that I truly think that prioritizing those individuals that have very complex chronic conditions that literally need to understand how to navigate the healthcare system because their health depends on it, to be honest with you. And so being able to, I see it from not only a medical point, but from a resource point. I mean, we don't have all the resources in the world that we need. And so being able to focus on the people that we know we can influence their health outcomes by being able to help them understand the healthcare system, I think is fantastic. And so as we go forward with this alignment, I really, again, would be interested in hearing more about it and how it's working and how we're actually affecting those individuals, especially those that are with very high needs, high medical needs. So thank you, thank you, thank you. And then my final comment is, thank you, Ted, for mentioning Mike McKinnon. I've looked at the website. I think it's fantastic. I'm always guilty of forgetting him in a agenda item and not having him speak. So I am so happy that you mentioned him because I was going to ask you if you didn't. And he does a fantastic job. And I think that the website is just extraordinary. It really is. Manager Greenberg?
Yes, thank you for that one. I said, and I was afraid I was going to forget somebody by naming people who weren't here, but clearly that is one of the individuals, Mike, who I was alluding to. Some of you know that the website has also been a particular project of interest to me since I got on this board. And also, although I know she couldn't be here, Manager Valadez. So thank you very much.
Thank you, Chair Greenberg. Appreciate that.
And Mike may not be presenting, but I know he's on the call, so he's listening.
Okay, well, that's good. And I didn't want him to think that we have forgotten him, not so much Chair Greenberg, as I have done in previous meetings. So I always want to extend that out there to make him realize how much we appreciate what he does.
Thank you.
Any other comments, Ted, before I move on to the next agenda item?
No, sir, I have nothing further.
Thank you again for a very informative item and discussion. And members, will put agenda item number 2, review the definitions of end of year goals pursuant to fiscal year 2021 strategic objectives. Mike Giesland and Monica Crowley will be presenting.
Yes, thank you. So in your packet was a memo and summary sheet of our strategic objectives for fiscal year 2021. And I want to apologize in advance to the board and also my colleague Monica Crowley for the misspelled word in here that has been changed in the base document. But you've seen this before. On November the 11th at the committee meeting, we presented these definitions that you see on the right-hand side. And what they do is they define what success looks like by the end of the fiscal year. So as we head into the budget development season, and as you recall, around July and August is when we start doing an accounting of, okay, how did we do with respect to reaching certain milestones or completing our strategic objectives that have been adopted by the board. And so, again, this document is, I haven't heard any feedback from any of the board members since the November meeting, but just wanted to check in with you one last time. This is what we will use as the standard to measure success. And this is what we're going to be reporting out on around the close of the fiscal year, and certainly after the close of the fiscal year in the subsequent annual report for FY21, that is. So happy to entertain any questions or certainly comments or suggestions on this. As you know, a lot of this work is already well underway. And we've already reported on some milestones, but we'll continue to do that throughout the course of the fiscal year. Thank you.
Thank you, Mr. Giesland. I appreciate that. And really, just for repetition, these are the items that we will receive as board members updates on in 2021 as we measure the success of our objectives that we put forward. Is that correct?
Yes, sir, that is correct.
All right. Any comments, questions, concerns by any board members? I'm seeing none. Okay, thank you, Mr. Giesland. I look forward to receiving those reports. I think it really does help us to formulate where we are or where we have been a success, especially as we look at moving into the future. So having that information is extremely helpful. Thank you. All right. Our next agenda item is to receive a report from the Eastern Crescent Subcommittee and take appropriate action on items discussed during the December 9th, 2020 subcommittee meeting. I will forego this item since all of our members that are on this meeting were at the Eastern Crescent Subcommittee. We did not take any action in that subcommittee, and there's no action needed in this committee meeting. Agenda item number 4 is to confirm the next Strategic Planning Committee meeting date, time, and location. Managers, our next regularly scheduled Central Health Strategic Planning Committee meeting is tentatively scheduled for Wednesday, January the 13th, 2021, immediately following the Eastern Crescent Subcommittee meeting at Central Health Administrative Offices, 1111 East Cesar Chavez Street, Austin, Texas, 78702, and or remotely by video conference, depending on the status of the governor's disaster declaration and stay-at-home orders. At this time, I'm ready to accept a motion for adjournment.
I move adjournment. I move adjournment.
Perfect. I have a motion by Chair Greenberg. I have a second by Manager Oliver. Any opposed to adjourning? Hearing none, we are adjourned. Thank you very much.
Thank you. Thank you, everyone.
Bye-bye.
Have a happy and healthy week.
You too. Thank you.